You're watching Ask Dr. Dora. Real questions, real answers, real transformation. Let's begin.
Hello, and welcome to Ask Dr. Dora. I'm Dr. Dora Dixie, board certified in family medicine and addiction medicine. Ask Dr. Dora podcast is my virtual medical ministry that is all about addiction medicine, substance use disorders, and the magnificent bodies we live in, where I always say knowledge is power. The more knowledge we have, the more power we have to take better care of our bodies for improved and hopefully optimal mental and physical health. Before I jump in, let me explain the difference between an opiate and an opioid. Opiates are naturally occurring compounds made from the opium poppy plant. Examples are morphine, codeine, and opium itself. Opioids are any substance that binds to the opioid receptors in the brain and body. They are the natural opiates and semi-synthetic opioids created in the lab using natural opiates as a base. Examples are oxycodone, hydrocodone, and heroin. Synthetic opioids are entirely man-made in laboratories with no natural ingredients from the poppy plant. Examples are fentanyl, drugs like it, methadone, and buprenorphine products. Previously, I talked about the pharmacology of opioids, and today I will discuss epidemiology. Epidemiology of opioid use is the study of its patterns of use, causes of use, and harm on public health. It also examines who uses opioids, how use patterns evolve, and what factors lead to substance use disorders, overdoses, and recovery. Opioid use is a worldwide problem, with North America having the highest rates of substance use disorders and overdose deaths. The U.S. and Canada have the most severe opioid epidemics due to prescription practices, availability of synthetic opioids, and socioeconomic factors. The prevalence of illicit opioid use is unknown because researchers only know about the people who participate in a study or enter a treatment program. It is estimated that 2.1 million people aged 12 and older have an opioid use disorder, and 9.3 million people reported misusing prescription opioids in the past year, as reported by the National Survey on Drug Use and Health in 2023. 2.7 million people live in Chicago and 8.8 million in New York City. If you pretend all those people misuse prescription opioids, that is an estimate of the prevalence of opioid use disorders in America. According to the Centers for Disease Control, in 2024, over 80,000 opioid overdose deaths occur every year. Let's look at some trends in opioid substance use disorder that can be either mild, moderate, or severe. In the 1990s to 2000s, there was a rise in prescription opioid use, and that was termed the first wave. In the 2010s, there was an increase in heroin use and deaths, labeled the second wave. In 2013 to present, resulted in an increase in fentanyl and synthetic opiates, or the third wave. 2020 to present reveals a polysubstance use crisis with opioids mixed with stimulants like methamphetamine and cocaine and other drugs like xylazine. Xylazine is used for sedation, anesthesia, analgesia, and muscle relaxation in horses, cattle, and other mammals. Demographic patterns reveal that historically, drug use is higher in men, but is growing among middle-aged women. The highest rates of overdose are among the 25 to 54-year-olds, with the early crisis killing white rural communities, but quickly rose in the Black and Hispanic populations. It is believed that that was partly due to fentanyl contamination. The epidemic is nationwide. The risk factors that influence the opioid use epidemic include chronic pain, a history of trauma, mental health disorders, and a history of substance use disorders. Poverty and limited access to health care or treatment is also a risk factor. The healthcare providers systematically overprescribed opioids and then failed to screen early for the development of substance use disorders. There are inadequate treatment spots for those that need it. In 2022, only 400,000 people received methadone treatment, when 9.3 million adults needed treatment for an opioid use disorder. Contributing factors include overprescription of opiates and opioids. From 1999 to 2008 alone, there was a fourfold increase in prescription opioid sales, associated with a fourfold increase in deaths attributed to prescription opioids. In the 1990s, pain became the fifth vital sign, and hospital administrators wanted to increase patient satisfaction. In 2006, patient surveys included feedback on how they felt their pain was being managed. Lack of education and opportunity plagued opioid overdose victims, as evidenced by a study published in 2020 that people with a high school diploma or GED accounted for 35.4% of all opioid-related deaths. In the late 1990s, the job market had fewer manufacturing jobs that historically guaranteed good pay and benefits. As jobs went down, overdose deaths rose. People who were unmarried accounted for 42.9% of all opioid overdose deaths, and divorced people died at a rate of 21.3%. According to a British Journal of Urology study in 2015, found that the prescribed number of opioid pills was far more than the patients took by about 200%. It also stated that 50% of all people with opioid use disorders get their supply of drugs from relatives with a prescription, and the overprescribing continues to fuel the epidemic across the nation. The United States has over-relied on prescription opioids for decades, leading to a sharp increase in opioid and opioid-related overdose deaths in the past 25 years. Every demographic is affected, but men lead the way in accidental deaths. Epidemiology of opioid use is not only the study of the patterns of use, causes of use, and harm in public health. It also examines who uses opioids, how use patterns evolve, and what factors lead to substance use disorders, overdoses, and recovery. The CDC reported a 24% decline in overdose-related deaths from September 2023 to September 2024 compared to previous years. There is great concern from addiction medicine researchers and treatment providers that if cutbacks in Medicaid insurance occur, there could be an increase again in opioid overdose deaths. Did you know that according to the National Institute of Health, the public health impact from drug overdose is the leading cause of accidental death in the United States and is the third leading cause of death in the African American community after heart disease and cancer? Please please, audience, study to show yourself approved. Get knowledgeable about addiction medicine, treatment, and research, and vote your conscience in all elections to help get your community's needs met. Thank you for joining me on Ask Dr. Dora today. To learn more about opiates and opioids, subscribe and listen to episodes. Like and share them with people in your sphere of influence. If you or someone you know needs treatment, in your search engine type findtreatment.gov or call or text 988. That is the Suicide and Crisis Lifeline. I'll see you next time. Thank you.
Got a question or want to be a guest on Ask Dr. Dora? Email us at hello@askdrdora.com. Subscribe, share, and we'll see you next week.